I now recognize the distinguished delegate of Pakistan to be followed by the distinguished delegate of Venezuela.
We appreciate the efforts of WHO for improving the health conditions and deliverance of the basic health services in occupied Palestinian territory, including East Jerusalem and in the occupied Syrian Golan, in the form of tangible projects and programs. We also appreciate the report of Director General on the health condition in the occupied territories and find its recommendations very important, especially those related to reminding Israel of its international commitments of granting free and unhindered access to health care facilities and respecting the sanctity of health infrastructure and paramedical staff. We are deeply concerned over the deteriorating health situation in the occupied state of Palestine, including East Jerusalem and in the occupied Syrian Golan due to Israel's occupation. The restriction to the ambulance transport and unnecessary hurdles, damage to the medical infrastructure, access to timely medical care and denial of family visits to the prisoners in Israeli prisons are unlawful Israeli practices that are in violation of international law and basic human rights. The unnecessary physical and technical barriers such as permit regimes created by Israel for accessing the referral hospitals needs to be condemned and actions taken for allowing unhindered access to medical facilities. We deplore that the assessment team was not given access to Palestinian prisoners. The continued Israeli occupation and restrictions on freedom of movement has devastating effects on the economy of the occupied territories, causing aggravated food security problem. According to the Director General's report, 1.6 million Palestinians are experiencing food insecurity, which is an alarmingly high number, indicating an imminent humanitarian crisis. The prevalent psychological, emotional, and mental distress is the outcome of Israeli discriminatory policies and gross human rights abuses committed with full impunity by the occupying forces. Mr. Chair, we believe that no state is above international law and right to health cannot be compromised, and there can be no justification for blocking or hindering the access to health facilities by anyone. We consider that the international community must not shun away from its responsibility of helping the Palestinians in overcoming the grave health challenges. The basic human right to health can be materialized by strengthening the health systems and infrastructure in the occupied territories. The financial and technical support provided by the international community is of pivotal importance, and the decision presented under Agenda Item 19 is implemented in letter and spirit. Mr. Chair, Pakistan lends its full support to the decision presented under Agenda Item 19 and strongly urges the members to support it. I thank you.